Hello, I am Dr. Anna Ramos, and today we are going to be discussing and identifying the top 10 fears of new counselors and clinical trainees entering the mental health field. These points are not based on clinical research, but on rather observation and years of work as a clinical supervisor in the mental health field. Let's get started.
Fear number 10. Licensing requirements, obtaining hours, and studying for the license exam.
For many new clinicians, the thought of completing all the requirements that states require for licensure can be overwhelming and quite burdensome. For example, passing the National Clinical Mental Health Counseling Exam is one requirement which was designed to assess knowledge, skills, and abilities for effective counseling services. However, according to the article written by Dr. Allison Carr with the American Counseling Association, approximately 40 to 45% of people failed the NCM-HCE exam on the first try. Talk about stressful. Guidance and direction from supervisors in the field who have already completed all the requirements can provide the much-needed support to boost their confidence and alleviate the stressors of licensing requirements.
Fear number 9. Silence/overly talkative counselor talking too much or not knowing what to say.
The idea of silence in therapy is presumed to be a potentially powerful therapeutic tool by allowing clients to reflect on their thoughts and feelings and convey respect and empathy. But it can also inhibit therapeutic work by raising anxiety and exerting pressure to communicate, according to the 2004 article entitled "The Therapist's Perspectives on Using Silence in Therapy." Many new counselors lack the experience of knowing how and when to use silence in sessions, thus adding to the fears of being overly talkative, not knowing what to say, or using silence in a non-therapeutic way. For example, silence is most effective after a strong therapeutic alliance is formulated and with clients' understanding of how it works in the session. Supervisors can explore this topic with new counselors to help them understand both the positive and negative aspects of silence, being overly talkative, and remedy the problem of not knowing what to say in ways that will be beneficial to the client.
Fear number 8. Lack of experience.
Number 8 is a classic concern in the counseling field: not enough experience. One of the dynamics of degree programs prohibits practicing on certain levels until the counselor completes their educational requirements. Sometimes the only exposure to the field is through their educational institution's internships or practicums. Counselors may be unaware of opportunities like working within shelters or answering calls on crisis hotlines, or even working within psychiatric hospitals to start the process of self-discovery, insight, and becoming an effective therapist. Whatever your exposure to the field, no new clinician will have all the answers to the complexity of treatment. Therefore, the role of mentor in the supervisory relationship is so valuable.
Fear number 7. Potential court situations and navigating subpoenas.
Even experienced counselors feel anxiety over potential court subpoenas and releasing clinical case files, let alone someone who is just entering the field. New counselors are often unaware of specialty areas that tend to be more at risk for court-related subpoenas, like custody battles or clients with pending criminal cases. Knowing how to respond and weighing the ethical and legal responsibilities are some of the key features that are paramount to the supervisory process. At Rockbridge, our supervisors share the responsibility of helping each counselor make appropriate and ethical decisions and alleviate the common fears of encountering the judicial system in ways that they have never experienced before.
Fear number 6. Severity of symptoms and working with suicidal or high SPMI clients.
The National Institute of Mental Health indicates the prevalence of serious mental illness is approximately 5.5% of all United States adults, which translates into 14.1 million people, approximately the combined population of Pennsylvania, Delaware, and Rhode Island. Knowing the proper therapeutic intervention, as well as safety protocols, can be alarming for new counselors. Conducting risk assessments, drafting safety plans, and recognizing severity of symptoms are part of the process, which are not always emphasized on master-level training programs. Developing these skills and learning to lean into training helps to address the fears of working with clients with severe symptoms or those who are actively suicidal.
Fear number 5. Theoretical orientation, or how to use my theory in actual practice.
Personality traits and personal belief structures directly influence a counselor's theoretical orientation. While in graduate studies, students are provided a plethora of theories and corresponding theorists that shape and influence their professional understanding of case conceptualization and theories of change. It is understandable that most new clinical trainees struggle with their own theory and how to use it in actual practice. Some of the best practice and best advice for new counselors is to study and gravitate toward those theories that pique your interest and energize your understanding. Once you have 1 to 2 theories that you can identify with, then you want to memorize, learn, and familiar yourself with the corresponding modalities, skills, and microskills pertaining to this theoretical orientation. For example, memorize 5 modalities and microskills that can best be interchangeable with that theory. Break the process down into bite-sized pieces and then start with what you know how to do.
Fear number 4. Improper diagnosis or making an improper diagnosis.
The National Institute of Health reveals in one study that more than 1/3 of patients with severe psychiatric disorders were misdiagnosed. This is a staggering statistic, which adds to the fear for many new clinicians of not making a proper diagnosis. Many times, students are limited to exposure in their field, plus learning and navigating over 900 pages of various components of the diagnostic manual. Within supervision, your supervisor will help you to understand and maintain the sources of data gathering, which include the clinical interview, the client's self-report, and additional assessment measures. In addition, it is also helpful for new counselors to memorize the 4 Ds of disorders: dysfunction, distress, danger, and duration, as part of the assessment process. The learning process is growing through failure.
Fear number 3. Personal mental health struggles.
Psychology Today published an article in April of 2022 titled Mental Health Among Mental Health Practitioners, where they cited 2 underlying reasons why healthcare professionals have a high rate of mental health disorders, which are burnout and compassion fatigue. In a randomly sampled study of 1,000 psychologists, 62% self-identified as depressed. Another survey found 61% of psychologists report experiencing clinical depression at least once in their life. The key here is that mental health professionals and new counselors entering the field must understand the importance of proper self-care and managing their own mental health first. Some clinicians entering the field find that balance is a topic that they talk about but do not apply for their own lives. As supervisors, we can support those entering the field by advocating for better salaries with fewer billable hours and generous paid time off packages to encourage self-care and counselor effectiveness.
Fear number 2. Imposter syndrome or afraid colleagues will think that I don't know what I'm doing.
According to an article in the American Psychological Association entitled Feel Like a Fraud, published in 2013, it states that the imposter syndrome is a form of intellectual self-doubt accompanied by anxiety and depression. Many new clinicians entering the field question whether they are equipped or skilled enough to be in a place to treat clients. Others feel that their colleagues and other mental health professionals will notice their ineptitude and expose them as a fake in the field. In either case, imposter syndrome can keep new clinicians from trying new job experiences, broadening their scope of experience and practice, or even operating to the fullest of their capabilities. As supervisors, we can encourage emerging mental health professionals to accept levels of discomfort, ambiguity, and even failure as part of the learning process, our authentic self, and away from the pitfalls of imposter syndromes.
Fear number 1. Causing harm to the client.
According to the Ethical Standards Casebook, the basic functions of the Code of Ethics is to educate members about sound ethical conduct. The authors further describe the purpose of mandatory ethics, compliance with minimal standards, and aspirational ethics, the highest standards of conduct to which professional counselors can aspire. Clearly, all clinicians in the field should employ both standards of minimal and aspirational ethics for conducting clinical practice. For new counselors entering the field, a sense of concern of doing no harm or non-maleficence is key importance. In fact, if a new counselor did not have concerns about doing no harm, I would be concerned. The fact of the matter is, when counselors keep the awareness of the code of ethics on the forefront of their thinking, violations and harming clients will be greatly reduced. Supervisors can help new clinicians by systematically reviewing the code of ethics and training new trainees with the proper steps of ethical decision making. Thank you for joining us as we have identified the top 10 fears of pre-licensed counselors entering the mental health field. If you'd like more information, please contact me at Dr. Anna at rockbridgecounseling.org or at www.rockbridgecounseling.org.